Hello, humans. Welcome back to Your Thoughts Are Valid, and I hope you all are doing great. So, this is the last part of Unit 4 and the last part of this crash course. This is part 17th and the last part of Unit 4, which is pain and its management. So, let's see what topics we are going to cover today. So, today we are going to cover pain management techniques, relaxation techniques, hypnosis, acupuncture, distraction, and guided imagery. So we will learn about these techniques and then we will end this crash course. So let's start with this video. So let's learn about relaxation techniques. Relaxation training has been employed with pain patients extensively, either alone or in concert with other pain control techniques. One reason for teaching pain patients relaxation techniques is that it enables them to cope more successfully with stress and anxiety, which may ameliorate pain. Relaxation may also affect pain directly. For example, the reduction of muscle tension or the diversion of blood flow induced by relaxation may reduce pains that are tied to these physiological processes. In relaxation, an individual shifts his or her body into a state of low arousal by progressively relaxing different parts of the body. Controlled breathing is added, in which breathing shifts from relatively short, shallow breaths to deeper, longer breaths. Meditation, slow breathing, and mindfulness also reduce pain sensitivity and can produce analgesic effects, possibly through a combination of relaxation and self regulatory skills. Spiritual meditation tied to religious beliefs can aid in the control of some pains, such as migraine headaches. Relaxation is modestly successful for controlling some acute pains and may be useful in treating chronic pain when used with other methods of pain control. Some of the beneficial physiological effects of relaxation training may be due to the release of opioids. One way in which relaxation therapy may work is to reduce the effect of the stress on the body, restoring normal equilibrium within the body systems. It is also important to consider the effect of a placebo treatment on pain. However, studies have proven relaxation to reduce pain level more often than not in conjunction with another modality. So, under relaxation techniques, we understand that it is employed with pain patients extensively, and it can be employed individually or maybe in coordination with other pain control techniques. And it is used so that patients can cope more successfully with the stress and anxiety. And relaxation also affect pain directly. For example, muscle relaxation, and then in relaxation, individual shifts his or her body into a state of low arousal. So basically, different parts of body finally relax, and controlled breathing is also there. Meditation is included. Spiritual meditation can be there. Then relaxation is modestly successful for controlling some acute pains, and even in chronic pain, it is useful sometimes. And like the main way it reduces pain is by reducing the effect of stress on the body and restoring it to normal equilibrium with the body system. And also the placebo treatment is considered under this. So let's move on to other pain management technique, which is hypnosis or hypnotherapy. So hypnosis is a procedure involving cognitive processes such as imagination, in which a patient is guided by a health professional to respond to suggestions for changes in perceptions, sensations, thoughts, feelings, and behaviors. According to the Society of Psychological Hypnosis, Division 30, hypnosis involves learning how to use your mind and thoughts to manage emotional distress, such as anxiety, unpleasant physical symptoms such as pain, and certain habits or behaviors such as smoking. Sometimes people also are trained in self hypnosis, through which they learn to guide themselves during a hypnotic procedure. During hypnosis, you will focus on relaxation and letting go of distracting thoughts. You may become more open to specific suggestions and goals, such as lowering pain. After your session, your therapist will go over the things and you can do to help you reach those goals. Research shows that medical hypnosis can help with both sudden, acute, and long term, that is chronic pain from cancer, burns, and rheumatoid arthritis. It may also ease anxiety some people feel before surgery. So here, all hypnosis or hypnotherapy doesn't mean that, like the first picture that comes to the mind when you think of hypnosis is that, someone is clicking that pendulum kind of thing in front of you, like that the thing which is going to and fro, any pendant or any, like any object which they basically use in front of your eyes to make you hypnotized. No, that is not hypnotherapy or hypnosis. It is a procedure in which cognitive processes, basically imagination, is involved, and patient is guided by health professional to respond to suggestions for changes in perception, sensation, thoughts, feelings, cognitive behaviors. So basically, it is used to manage emotional distress, unpleasant physical symptoms, and certain behaviors, certain harmful behaviors. Also, during hypnosis, you will focus on relaxation and you will let go of distracting thoughts. And after your session, therapist will go over the things that you can do to help you reach your goals that you set for yourself. Maybe it's related to some letting go of certain habit, or maybe some unpleasant physical symptom. And this can be used for chronic pain or acute pain, like cancer, burn, rheumatoid arthritis, and it also ease anxiety. Moving on, at its most basic, hypnosis treatment consists of four ordered stages. Induction, usually to focus one's attention. A deepening, usually to deepen one's relaxation of the body. Suggestions, usually for changes in the client's experience of pain, and a debriefing. Okay, these are the four stages. Okay, first is induction, where the focus is on getting the client's attention. Then deepening, where the focus is on deepen one's relaxation of the body. Then third is suggestion, which is for changes in client's experience of pain. And then last is debriefing. Beyond this basic structure, there are several variations and features of its practice. For example, if one used hypnosis for chronic pain, one could focus on changing the sensations from pain to something else, or on shifting the patient's attention away from the pain. Sometimes underlying dynamics, motivations, or unresolved feelings may influence pain, and hypnosis can aid in this unconscious exploration and contribute to the resolution of these underlying issues. In addition, individuals may be instructed to practice self hypnosis outside of the treatment setting, or may be given audio recordings of sessions to help with home practice. Everyone respond differently to hypnosis. Some patients report their experience as trance-like state, other may experience it as imagery or soothing of body sensation. Most people describe hypnosis as pleasant experience associated with feeling of being focused and absorbed in the experience, as well as being more alert, relaxed, comfortable, and peaceful. No matter what the experience, patients consistently report better health and happiness after using these techniques. Imaging data has indicated that hypnosis affects cognitive control by modulating activity in specific brain areas. Hypnotized subjects have shown reduced brain activity in both visual and the anterior cingulate cortex, which plays a role in a wide variety of autonomic and cognitive functions. Moving on, hypnosis has been found to be generally more effective than other non pharmacologic interventions such as physical therapy and pain education. Hypnosis may be able to provide analgesia, reduce stress, relieve anxiety, improve sleep, improve mood, and reduce need for opioids. Clinical hypnosis should be conducted only by trained healthcare professionals such as licensed psychologists or master's level clinicians. There are some contraindications for hypnosis that one must keep in mind. First, patient should provide informed consent before beginning hypnotic process. Health professionals who conduct hypnosis may not be comfortable providing this type of therapy to all patients. Not everyone is a candidate for hypnosis, and certain extreme cases are discouraged to pursue hypnosis, including anyone with serious psychological disorders that have gone untreated, persons under the influence of recreational drugs or alcohol, and anyone who is having delusions or hallucinations at the time of treatment. Moving on to the next pain management technique, which is acupuncture. So, acupuncture involves inserting thin needles into specific points on the skin. It aims to restore balance within the body and encourage it to heal by releasing natural pain relieving compounds called endorphins. Some people find that acupuncture reduces severity of their pain and enables them to maintain function. Acupuncture is thought to decrease pain by increasing release of endorphins, chemicals that block pain. Many acupoints are near nerves. When stimulated, these nerves cause a dull ache or feeling of fullness in the muscle. The stimulated muscle sends a message to the central nervous system, the brain, and the spinal cord, causing the release of endorphins that block the message of pain from being delivered to the brain. Acupuncture may be useful as an accompanying treatment for many pain related conditions, including headache, low back pain, menstrual cramps, carpal tunnel syndrome, tennis elbow, fibromyalgia, osteoarthritis, especially of the knee, and myofascial pain. Acupuncture also may be an acceptable alternative to or may be included as part of a comprehensive pain management program. Then there is distraction. There are two quite different mental strategies for controlling discomfort. One is to distract oneself by focusing on another activity. The other kind of mental strategy for controlling stressful events is to focus directly on the events but to reinterpret the experience. Distraction is a useful technique of pain control, especially with acute pain. For example, in one study, 38 dental patients were exposed to one of the three conditions. One third of the group heard music during the dental procedure. One third heard the music coupled with suggestion that the music might help them reduce stress. And the third group heard no music. Patients in both music groups reported experiencing less discomfort than did patients in no treatment group. Distraction is most effective for coping with low level pain. Its practical significance for chronic pain management is limited by the fact that such patients cannot distract themselves indefinitely. Moreover, distraction by itself lacks analgesic properties. Thus, while effective distraction may be most useful when used in conjunction with other pain control techniques. Moving on to guided imagery. So, it can be a powerful technique to use with coaching, counseling, and psychotherapy clients who have difficulties accessing their inner world or articulating their inner experience using only words. Guided imagery is rooted in the practice of multisensory visualization, which involves guiding a client on an imaginary journey with their eyes closed, following some short breath work exercises to induce relaxation. It can inspire and induce inner transformation to drive desired behavioral change in areas such as addiction recovery, sports psychology, and stress management. Sorry. Not only does this technique refer to the visual aspect of imagination, but all five sensory channels are stimulated to transform the inner world, including thoughts, feelings, and sensations, including sixth channel of internal self-talk, often through the use of affirmations. Guided imagery mobilizes your client's imagination to practice a visualization that addresses a specific psychological need. Most guided imagery will use a combination of breath work, relaxation, and verbal guidance to stimulate the imagination through a combination of sensory experiences. Beginning a guided imagery session with relaxation and breath work helps overcome any resistance to the process by making client more suggestible. Guided imagery works because brain and body respond to imagined experience almost as strongly as if it were really happening. The brain responds to imagined negative outcomes by flooding us with anxiety, which is uncomfortable and can make the imagined threat feel real. For example, guided imagery can be used to relax during periods of stress, regulate emotions, help control pain, and even as an adjunctive intervention during cancer treatment to enhance healing process. A therapist can teach sensitive clients guided imagery techniques to help rewire brain by activating otherwise dormant neurological pathways through all six mental channels. Used repeatedly, guided imagery can help overcome old triggers and cause reactivity and overwhelm. Somatic imagery is another guided imagery intervention that uses multisensory image making to access a client's inner experiences and resources that may not be available through talking therapy alone. Research has shown that traumatic experiences overwhelm the nervous system and are often encoded at a visceral, embodied level rather than as stories that can be accessed through left brain activities such as language analysis and verbalization. Somatic imagery is a guided imagery intervention used to access right brain processes that are non-verbal or pre-verbal. Visualization and pain management. Chronic pain causes stress, so it makes sense that stress management techniques may impact pain. One very specific visualization technique is graded modal imagery, which is used by those with reduced mobility because of chronic pain to visualize moving around pain free. All pain comes from the brain, and our brains are neuroplastic. So, the more pain we experience, the more those pain signaling nerves pathways are activated by default, leading to a greater sensitivity to pain over time. However, because of neuroplasticity, brain can be retrained through GMI to carve out new neural pathways where movement becomes increasingly experienced as pain free through the practice of visualization. So that is it for today's video. I hope all the five techniques we studied today are clear to you. First, we studied relaxation techniques, then we studied hypnosis, then we studied acupuncture, then distraction, then guided imagery. And even this part comes under guided imagery only. So I hope everything is clear to you. And with this, we come to an end of we come to an end of this crash course of health psychology, and I hope you guys have a good idea about health psychology now, like what all comes under health psychology, and if you want to pursue your career in health psychology, what topics will you be dealing with in detail. If you have any doubt, please do ask in the comment section and I will definitely reply. And thank you so much for doing this crash course. Your certificate will be provided to you within 15 working days. So that is it for today's video. And thank you so much for doing this crash course.